Everyone. Today I'll be enumerating the arteries and veins of lower limb and discuss in detail about Great Saphenous vein. So let's start with the arteries. In the abdomen you can see the aorta, which divides into the two common iliac, which then divides into an internal iliac and an external iliac. This external iliac then passes under the inguinal ligament to enter the lower limb. Thus, this continuation of the external iliac is called the femoral artery. This femoral artery descends downwards along first passing through the femoral triangle, then into the Hunter's canal. Then it pierces the deep fascia to reach the posterior aspect of the thigh. Thereon, it descends as the popliteal artery. The popliteal artery at the lower end of the popliteus muscle terminates into its terminal branches. One is the anterior tibial artery and the other one is the posterior tibial artery. This posterior tibial artery descends along the posterior aspect of the leg. It passes below the medial malleolus, then re-enters the sole of foot and terminates as the medial plantar artery and the lateral plantar artery. The posterior tibial also gives a important branch called the peroneal artery. Peroneal artery supplies the lateral compartment and also the lateral aspect of the foot. The anterior tibial, as we can see, passes above the interosseous membrane to enter the anterior compartment of leg. Here it descends downwards, passes deep to the extensor retinaculum, and once it exits here, it is called the dorsalis pedis artery. So it supplies the dorsum of the foot. So these are the arteries of the lower limb. Now we'll see the veins. Veins are again divided into superficial, deep and perforator veins. First we'll see the deep veins. These are veins which mainly run along with the arteries. So first we'll see the posterior view. Here we have the sole of foot, where this is the medial plantar vein and this is the lateral plantar vein. These join together to form the posterior tibial vein. And in the anterior aspect of the foot, you have a dorsal venous arch from which you have the anterior tibial vein. This anterior tibial vein is in the anterior compartment, but then it passes above the interosseous membrane to enter the posterior compartment of the leg, that is in the popliteal fossa, and joins with the posterior tibial vein to form the popliteal vein. Now the popliteal vein ascends upwards and after piercing the deep fascia passes into the anterior aspect of this thigh. Okay, here onwards in the Hunter's canal it will be renamed as the femoral vein. It again descends upwards and passes deep to the inguinal ligament. Till here this is called the femoral vein. One thing to remember here is that below the knee all the veins are 2 in number. That is, they ascend as venae committens, 2 veins along with each artery, right? Above the knee, that is the popliteal and femoral are solitary. There is only a single vein. So now we will see the superficial veins. These veins lie just deep to the skin. Okay, and they carry blood mostly from the skin and the superficial fascia. So this leg is the right leg, and we are seeing the medial aspect of it. And this long vein starting from the foot, ascending along the leg and the thigh, is the Great Saphenous Vein. On the lateral aspect of the foot as well, you can actually see another vein which is superficial. Okay, just think this is the right leg and it's the lateral view. So there's another vein which passes along the lateral margin behind the lateral malleolus and ascends upwards to finally drain into the popliteal vein, that is called the short saphenous vein. Here this dark blue colored vein that has been shown in this image is the femoral vein and the popliteal vein, and the light blue ones are the superficial veins. So remember these Great Saphenous, this is the one Great Saphenous, okay, and all these other light blue ones are its tributaries. Okay, so these are all forming veins in the superficial fascia, finally draining into the Great Saphenous. And you can see on this image the small saphenous on the lateral aspect of the foot and finally draining into the popliteal vein. Fine. So another set of veins, that is the perforating veins. What these do is connect superficial vein to the deep vein. So the blood is shunted from always in a unidirectional way from the superficial to deep set. And you must know that all these veins have valves in them. So you can notice these valves. Usually they will be open like this, and once the blood has passed through them, they will close like this. So once they are closed, they prevent the retrograde flow of blood. Right? So these are present in both superficial and deep set. They allow only unidirectional flow. Again, these valves are also present in the perforating veins. Again, these will open up to allow unidirectional flow, always from superficial to deep. Now let us study in detail about the Great Saphenous Vein. It is called so because it is the longest vein in the body. The Great Saphenous Vein, when studying, we need to have certain objectives. That is, we must know how it is formed, what is its course, or what is the path taken by the vein in the lower limb, where does it terminate, what are its tributaries, the perforators and its importance, and some applied aspects. So this is the Great Saphenous Vein, right? Now we shall see it in detail. Starting with the basic introduction, this Great Saphenous Vein is the longest vein in the body, so also called the long saphenous vein. It is also the preaxial vein of the lower limb. Okay, so during development, this is on the preaxial side. That's why it's called the preaxial vein of the lower limb. Where is it located? This vein is located in the lower limb on its medial aspect, and it is within the superficial fascia. What is its extent? It extends from the foot, ascends along the leg, the thigh, up to the uppermost part of the thigh to finally terminate. Right? So this we are not showing the complete course of the femoral vein, but just a short segment of it. And here you can see the Great Saphenous Vein finally draining into the femoral vein. How does it form? So can you see in this image this slight elevations, right? This is produced by this distended Great Saphenous Vein. So if you see this dorsal venous arch is a vein on the dorsum of the foot. It receives or drains blood from the anterior part of the foot. It is joined by a vein on the medial margin of the foot, which is called the medial marginal vein. So these two combine together to form the Great Saphenous Vein. Okay. So these two together form the Great Saphenous Vein. That's its formation. So that is just a small animated section. Now let's see the course or the path. So the vein runs once the vein has been formed, it runs 2.5 centimeter in front of the medial malleolus. So we know here this bony projection on the medial side is the medial malleolus formed by the tibia bone. Okay, just around 2.5 centimeter anterior to it, the saphenous vein ascends up. Now in the leg, it ascends along its medial border. Once it reaches the knee, it passes a bit posteriorly, or you could say in the posterior-medial aspect of the knee. More accurately, it passes around 1 hand's breadth behind patella. So if you palpate your patella over here, around 1 hand's breadth posterior to it would be the approximate location of the Great Saphenous Vein. Then as it ascends in the thigh, it again comes back into the anteromedial aspect of the thigh, okay, and then ascends upwards. It finally reaches the Saphenous Opening. Saphenous Opening is a defect in the deep fascia. So just imagine this is the leg and there is a deep fascia, right? So it's like a stocking which has a hole in it, okay. So deep to it are the deeper vessels like the femoral vein. The Great Saphenous Vein runs in the superficial fascia. The femoral vein lies deep to it, right? So the Great Saphenous Vein will pass through this opening to drain into the femoral vein. Now this opening, yes, it is defective, but it does have a very thin layer of fascia, but it is again very thin and has multiple perforations. That's why it's called cribriform. And it is by piercing this fascia in the saphenous opening that it reaches the femoral vein. So you can see here in this diagram much more clearly that this bluish thin fascia is the deep fascia or the fascia lata. And this is the defect which you can see, which is called the saphenous opening or the fossa ovalis, because it's oval in shape. And this is usually covered by a very thin cribriform fascia. You can see other lymphatics and some branches of the femoral artery will be exiting through this fascia, creating these perforations, hence called cribriform. And you see this is the Great Saphenous Vein, okay, passing through and finally terminating into the femoral vein. So now you know its formation, its course and its termination. So in this diagram you can appreciate the fossa ovalis again. So this purplish tinged structure is the fascia lata or the deep fascia of leg. This is the saphenous opening. Deep to it is the femoral vein. So in this diagram again you can see this is the Great Saphenous Vein which is entering. And before it enters you can see that the Great Saphenous Vein receives a lot of tributaries. Okay. So now we will be discussing about the tributaries. Remember that this junction where the Great Saphenous Vein enters the femoral vein is also called the cephenofemoral junction. So the tributaries, we will begin from the distal end of the foot, okay, where it forms. So the first two are the formative tributaries, which we have already discussed, right? The dorsal venous arch and the medial marginal vein. These two are called the formative tributaries. Then, as it ascends upwards, it receives two more branches in the leg. Okay, one from the anterior aspect, so it is called the anterior leg vein. Another vein, which is from the posterior aspect, forms an arch before it drains, so it's called a posterior arch vein. Now again, the great saphenous ascends upwards, reaches the thigh. Here it reaches, this you can see is the medial aspect, or you could say this is the lateral aspect of the thigh, and this is the posteromedial aspect of the thigh. So the veins have been named accordingly. This is the anterolateral vein, and this is the posteromedial vein. Okay, so here you have seen 6 tributaries starting from foot in the leg 2 and 2 in the thigh. And now we'll discuss a few more, that is small tributaries draining into the saphenous just before it passes through the saphenous opening. So we can see here 3 tributaries, 1, 2, 3. This small vein, you can see, drains the external genitalia. That's why it has been named as pudendal. So this branch is nothing but the superficial external pudendal vein, okay, because it's superficially located and it drains the external genitalia. Then you have the superficial epigastric vein. So in this region you have the anterior abdominal wall, right? So the lower part of the abdominal wall is drained by the superficial epigastric vein. Then this vein drains the abdominal wall close to the ilium here. So that is why it has been named as superficial circumflex iliac vein. Okay. These 3 veins drain into GSV. Now just before the GSV terminates into the femoral vein, that is deep to the deep fascia, you have the deep external pudendal vein. It has not been shown in this diagram, but again that drains the external genitalia and it is located deep. That's why it's called the deep external pudendal. Fine. So you have the 10 tributaries. Remember, branches for arteries and tributaries for vein. So dorsal venous arch, medial marginal vein, posterior arch vein, anterior leg vein, anterolateral vein, posteromedial vein, and the 3 superficial and 1 deep branch tributary. Now the perforators play a significant role here for the great saphenous vein because it helps in shunting a lot of blood into the deeper veins, right? So their locations are very important, especially for surgeons when they are performing surgeries on the long saphenous vein. So at the mid thigh, that is within the Hunterian canal, there is a perforator which drains the great saphenous vein blood into the femoral vein. Okay, that perforator is called the Hunterian perforator. At the knee, the GSV has a perforator connecting to the popliteal vein. Okay, that is called the Boyd's perforator. And at the ankle, the posterior arch vein connects certain perforators to the posterior tibial vein. So these set of 3 upper, middle and lower ankle perforators have been named as cockets. And some other ankle perforators are also there which have been named as May and Custer, but these are the most important ones. Okay. coming to the valves, remember that within the entire length of the GSV, there are approximately 10 to 15 valves present, and these ensure that there is unidirectional flow of blood. The most important valve is the Cephenofemoral Valve. So this valve is present at the cephalofemoral junction. So this valve, if there is any incompetency or if it is defective, what happens is there is retrograde flow of blood. This would lead to the great saphenous vein getting dilated. There will be stagnation of blood. Okay. So these valves also play an important role in maintaining the integrity of the saphenous vein. So now, once you understood the anatomy, let us see some conditions where the great saphenous vein is affected. One is the varicose vein. Then we can see some very important uses of this vein. One is venous section for cannulation and so on, and another one is its use as a bypass graft. Okay, fine. So what is venous section? You make a cut in the skin, expose the underlying vein, make a cut in it, and you put a cannula in. Either you can introduce drugs, you can draw blood, or push a lot of fluids. So this is usually done, venous section is usually done as an emergency procedure when all the other peripheral veins have collapsed and you are not able to access any other vein. So because this is quite a large vein, you can easily access it. So to do this procedure, you need to know its important surface landmarks, right? So this is the one where you palpate the medial malleolus, and just 2.5 centimeter anterior to it is the approximate course of the great saphenous vein. So this is where you will look for the great saphenous vein, right? So venous suction is the cut down procedure. Then what is varicose vein? We spoke about valves, right? So if the valves are incompetent, or if there is deep vein thrombosis, the blood will stagnate in the great saphenous vein. So this will lead to dilation of the vein, and it will become tortuous. That is, tortuous is there will be a lot of twists and turns, right? So if you see the veins over here, you can appreciate that there are a lot of twists and turns. This is called tortuosity, right? So the veins are dilated, tortuous, and there is a lot of stagnation of blood in the superficial venous system. Okay, so these all lead to all these skin changes, and this patient may suffer from venous ulcers and so on. So that signifies the importance of the valve system in these superficial veins. The saphenous vein has been quite often used as a bypass graft. Bypass is where the coronary bypass graft. So just imagine that this is the right coronary artery, which has a block or a thrombus, which has led to poor perforation or poor flow of blood into its distal branches, right? So the blood cannot flow past the block. So the surgeons, what they do is they cut out a small segment of the great saphenous vein, and because there are these valves in them, it is important to invert it, okay, to allow for the blood flow. And then they attach one end to the aorta and the other end distal to the block. So this would allow continuous flow of blood to even the distal branches of the blocked artery. So again, so this is the bypass graft. So when you're talking about great saphenous vein, remember you have to always start with a brief introduction explaining where it is located, what is its extent, and so on. Then, because it's a vein, you have to talk about its formation, the veins or the tributaries that form it. Then, its course in the area, its termination. After that, you have to talk about its various tributaries. In case of Great Saphenous vein, perforators are very important. So, you must mention at least these three perforators which we talked about: Hunterian, Boyd and Cockett. And lastly, you must at least know a few applied importance of this vein, right? Venous section, bypass graft, and a pathological condition, that is your varicose vein. So that was my discussion on Great Saphenous vein. Thank you for listening. Have a great day.